Good evening, everyone. My name is Joyce Ann Eclarino, and I will be focusing on the chronic disease lupus. Systemic lupus erythematosus, commonly known as lupus, is an autoimmune disease where the body's own immune system mistakenly attacks other vital organs such as the heart, kidneys, brain, as well as attacking connective tissue in the body. Normally, the body's immune system produces antibodies, which are proteins in the blood that are produced to eradicate or fend off unknown or foreign invaders in the body, thus creating a level of immunity towards disease agents like the flu. In the event of lupus, the immune system can't differentiate between foreign invaders in the body from the body's actual healthy cells or tissues, and as a result, it creates and sends autoantibodies to attack healthy tissue. When the autoantibodies attack and destroy healthy tissue, it causes inflammation, pain, and extreme damage to those parts. As seen in the picture, lupus can affect a multitude of areas in the body. Symptoms of lupus can include fever, fatigue, aches and pains, weight loss, loss of appetite, nausea, painful aching joints and muscles, swelling that causes discomfort and sometimes permanent joint damage, abnormal sensitivity to sunlight, mouth ulcers, hair loss, and a butterfly-shaped rash across the bridge of the nose and upper cheeks on both sides of the face. Although the disease mostly affects blood cells, joints, and the skin, it can also cause severe damage to vital organs such as the kidneys, brain, and heart. Complications tend to manifest in the form of skin lesions and rashes, renal or kidney failure, cardiovascular disease and stroke, as well as the development of arthritis. What makes the disease hard to diagnose is that its symptoms can relatively fall under any other disease. Also, symptoms may vary in severity from person to person, and its nature to manifest in spontaneous flare-ups makes it difficult to detect. Along with genetic susceptibility, environment plays a role in the manifestation of symptoms tied to lupus. Some common environmental triggers of lupus flare-ups can include exposure to sunlight, emotional stress, exhaustion, exposure to certain chemicals such as silica and pesticides, exposure to specific viruses, for example Epstein-Barr virus, an infection in the body, any major injury, as well as antibiotic drugs. Here is an example of a manifestation of lupus as seen on the skin. And here are more examples of other physical manifestations of lupus. According to the Centers for Disease Control and Prevention, there is an incidence of 1,600 new diagnosed lupus cases each year. It is estimated that at least 1.5 million Americans are currently living with the autoimmune disease, and that it is affecting 5 million individuals worldwide. Lupus most What is difficult about the improvement of lupus is the lack of information we have about it. Little is known so far about the disease, including its root cause, which makes detection and plan of care or treatment difficult. There has been a connection between individuals with a family history or genetic predisposition of lupus. However, despite someone having the genetic disposition of the disease, it is unclear how the disease would be triggered to develop or manifest in one family member versus another. It is a multifactorial autoimmune disease that doesn't take just genetics to develop. It could be a basis of genetics and environment. Lupus can also develop in individuals with absolutely no family history of lupus. Lupus is difficult to predict as symptoms also mimic those of other illnesses or diseases. That's why, unfortunately, diagnoses on average may take many months up to years, with one occurrence reaching up to 6 years. As of today, there is no cure for lupus, and the treatment available for it administers to the complications caused by the disease to improve the quality of life of an individual diagnosed with lupus. Not many people know its existence, therefore are not getting themselves or their families tested. That concludes my. Thank you.